Me personally, I'll take the governor's advice and the advice of the CDC, and I'll pick that up or have it delivered. I won't go sit in a restaurant, okay? That means really thinking about those choices and guarding against doing those things, by the way, that are still not allowed in the order, but people may think, hey, you know, if I can go to a restaurant, surely I can do this. Surely I can play a game of pickup basketball where we're within 6 feet of each other if I can go to a restaurant. No, the order doesn't allow that, and there's no way that is like getting a haircut, right? There's no way to not be 6 feet apart, and furthermore, you're breathing a lot heavier than you are when you get a haircut. So we can't look at these orders that have come from the governor and say, well, if that's okay, these 2 or 3 other things I'd like to do must be okay as well. You know, we've already seen in deaths, the week's not over yet, we'll have tomorrow as well, but we've got a 20% increase in deaths this week. And so it's not a time for you to slack off on making those good decisions. 3 things I want you to think about on making good decisions, right? 1 is avoid. Avoid unnecessary contact with people outside your family. And 2 is distance. When you're out and about, keep a 6-foot distance. And 3 is face covering, right? We're learning more and more that the face covering is a good protector. Doesn't mean we can get within 6 feet of each other in the store, but it means it's a very good idea to wear your face covering. So let's talk about I've had some questions from folks, and I want to talk to you about that. We've had a lot of people contact me on social media and the internet saying, my boss wants me to come back to work. I don't believe my business is actually open. What do I do? Okay. So the best thing to do is to talk to your boss, right? And see if you tell your boss what you think, and why you think your business isn't open. Find out why they think it does fall under the governor's order. Generally speaking, when we look at the governor's order, and because you've got the CISA list, the critical infrastructure list from the federal government, and you have the things that were already open, like elective surgeries and car dealerships, now you have this new list of things. There's no way I can stand here at a press conference and tell you everything that's open and everything that's closed and answer all your questions about your individual situation. But generally speaking, when we look at the governor's order, it went on retail, restaurants, sole proprietorships, and movie theaters. And I may leave something out there. So for instance, if your business is to go into an office where you all sit in a large room, that's not a sole proprietorship. The governor is very clear in when he defines sole proprietorship as someone working alone, right? So if it's you're the only lawyer, but there are 5 employees working with you, it didn't okay the 5 employees coming in. And furthermore, and lawyer is maybe a bad example because lawyers are allowed to go in their office if their client is in imminent harm or if they're court ordered for some reason to go in there. But for those services, services like a lawyer, like an accountant, like some sort of a planner or something, it's sole proprietorships that are open so far, not big group gatherings. And so talk to your employer about that. You know, employers, I think this is really, really important for us to remember. It's the people that are going to serve those chips and salsa and bust those tables, the people that are going to deal with that customer who wants to try on an item that are in increased risk of contact. And so we want to work together, right? We want to kind of meet and talk about it, meet and confer before we open with our employees. Hey, here's my plan to keep you safe, right? And what do you think? And well, I think we need this. If we have that trust built up, this is going to go so much better for everyone. I'm going to talk to you about things that are still closed as well. A couple of things where people have been asking us about this on social media too. If you are a cosmetology service, it's not just barbershops and it's not just hair salons. If you're a cosmetology service, you're still closed, okay? if you are a K through 12 school, and like one of these academies, and you're thinking, let me bring the kids back in for testing, or let me bring the teachers all in for some in-service, you're only allowed to, under the governor's order and under the Dallas County orders, people are only allowed to come in sufficient to facilitate online learning. Having 300 people come back in just because you want them to have an in-service is still not okay. And I'll take some questions from you, but let me let Dr. Wong tell you about what's going on with nursing homes and some of those things. My mask, dude. All right. Grandpa lost his mask somewhere.
Yeah, so as the judge mentioned, 187 new cases were today, which is the highest number, and yesterday was the highest number before today. So the total count's 3,718, and the 2 deaths today bring us to a total of 106 deaths. In the county jail, we're now seeing a total of 219 inmates that have been confirmed positive, and 24 jail employees that have been positive. Also in the state TDCJ jail facilities, the state is reporting TDCJ COVID-19 Medical Action Center is reporting 22 COVID-19 positive tests in the Hutchins State Jail. However, our health department, DCHHS, has received only 11 reported cases at this time. And 2 COVID deaths have been reported among inmates at the Hutchins State Jail. Also, 3 TDCJ officers from the Beto unit in Anderson County have been reported as Dallas County residents and COVID-19 positive. With respect to the homeless shelter situation, we're still 43 residents now from Dallas Life have tested positive. With respect to long-term care facilities, Monticello West, 36 residents or staff have been positive in 18 deaths. Skyline, 58 residents or staff and 3 deaths. Edgemere, 11 residents or staff and 4 deaths. The Reserve at Richardson, 15 residents, 3 deaths. Brentwood Place 1, 84 residents or staff and 9 deaths. St. Joseph Village, 1 resident, 0 deaths. Villages of Dallas, 1 resident and 0 deaths. Brentwood Place 2, 21 residents or staff and 1 death. Winters Park Nursing and Rehab Center, 2 residents or staff and 1 death. Duncanville Health and Rehab, 29 residents or staff and 0 deaths. The Avenues of Park Forest, 7 residents, 0 deaths. The Madison on Marsh, 2 residents, 0 deaths. Presbyterian Village North, 16 residents or staff and 0 deaths. The Villages at Richardson, 16 residents or staff and 0 deaths. Balch Springs Nursing Home, 1 resident and 1 death. Bethel Senior Care, 4 residents or staff and 0 deaths. Edgewood Rehab and Care Center, 31 residents or staff and 1 death. Avante Rehab Center, 11 residents or staff and 0 deaths. Grand Book Memory Care, 1 resident, 0 death. And Lake West Rehab and Skilled Care, 1 resident and 0 deaths. So that's our final count on the nursing homes. I did want to show 2 charts. One, if we start it back at the beginning, so go ahead and click that start. This from the start, January. This is the deaths per month in Dallas County. And you can see as we progress in time into January, now again to February, and where COVID-19 deaths start increasing. We're at 7. It was the lowest in the top leading causes of death. As we get into March, how the COVID-19 deaths creeps up and keeps getting into being now It is now the third leading cause of death in Dallas County after heart disease and cancer. So again, it just sort of graphically shows how the number of deaths in our county has now become a significant, again, now the third leading cause of death per month in Dallas County. Next, we're going to show, and this is in our interactive website put together by PCCI, Parkland Center for Clinical Innovation. And this is the zip code maps that we show all the time and that we put out there, but you can interact with them. But wanted to show how this changes, and actually I don't know if we can get it to the map part on the right side or something. So, let's see, we'll go on the right, there, great. And then if we look at this, yeah, so you can see new cases, how it changes in new cases in the last 14 days, new cases, those are new cases in the last 14 days, how the hot spots are here, new cases in the last 7 days, then it's more here and there, and how that's changed over time from the start of the number of new cases. And last thing just wanted to show is this heat map where you can see, again, these are the number of cases. The shaded areas are where there are more number of cases in Dallas County. The couple of hot spots, some of those, that's the jail, a few specific long-term care facilities. But then you can see some other sort of areas where there is more diffuse numbers of cases in these areas, showing us, again, some of the hot spots that we have in Dallas County. So I think that's all that I have.
And we also, again, as I said, and I'll reiterate, worker safety is incredibly important. We're going to do everything that we can to keep workers safe as they return to work. Start by talking to your employer about your concerns always. But there also is now a portal at dallascountycovid.org for worker safety concerns. You can go in if you're a resident of the county and voice a concern, and we'll check that out for you as well. And with that, I'll take any questions people may have.
One of the things the governor's office has been mentioning a lot lately is the infection rate and pointing out that statewide the infection rate, so the percentage of people testing positive out of the total number tested is going down, the statewide numbers. What's the most recent data in Dallas County? I think the last summary report, it was like most recent as of the 18th of April, and it was 12.5% still there. Which is much higher than the state level. Do you all know what the latest infection report or rate is now for Dallas County?
And it's been hard to get all of the data. Actually, City of Dallas, and we've been trying to get more of the data reported from the labs. The City of Dallas currently has the most up-to-date reporting, but they're still missing data on that. I think with those figures, it's around 14 to 15% that are positive. But the denominator, again, the numbers are still missing some information, but that's currently where we have. And
do you think that's a good indicator for us to be looking at to kind of get a sense of the direction we're headed as a county?
Actually, there are some other indicators that I know we've had an expert panel. The judges put together a public health advisory committee with experts from UT Southwestern, the Dallas County Medical Society, Parkland, others. And so there's some indicators that have been identified with that group, things like number of hospitalizations and changes. It's really looking at the trends in those numbers, number of persons in the ICU beds with COVID. We're also working on looking at deaths. We're working with the medical examiner's office to increase testing of those that are going through the medical examiner's office so that all of them would be tested. And so that would be another indicator. But looking at some of those more steady indicators that aren't as dependent on the testing that are out there. But it's really looking at trends also and, seeing where those trends are going.
Yeah. As far as the testing, Judge, I know you mentioned, I think it was, still staying pretty steady in terms of the federal testing through the sites at AC and in the field house. Do you have a hard number in terms of how many tests the labs, those private labs, are doing? Are our labs even required to report all of that information in terms of the total tests that they do, as opposed to just telling you when they have a positive case?
Well, we don't have great numbers on that, unfortunately. I talked to the chief epidemiologist for Dallas County on the way over here and asked that very, I'm sorry, his question was, you're not Mike, Trey?
No.
Let me back up. The question was, do we have a really good number on how many tests are being performed in Dallas County at private labs? We have some idea of that, but unfortunately, we don't have up-to-date, accurate information on that here. We're trying to get better information on it. I've talked to the head epidemiologist for Dallas County Health and Human Services on the way over here and to see if I could get that information, but we don't have that. The key thing to look at on this, though, because there are a lot of people that are, and I understand this because many times a day I'm one of them, that are desperate to find some way to explain this so that we can go back to doing what we want to do and living our lives, right? The things that if you put testing aside, when you're making a decision about what you should do and how you should conduct your life, what the CDC and the health authorities are saying is you need a 2-week decline in deaths, infections, and positives, okay? Let's put testing aside for a second. If you don't like testing, we're seeing an increase this week in deaths, and we're seeing an increase in positives. And then the second thing, if you got over that hurdle, the second hurdle is sufficient testing to really be able to test those employees that go back to work, right? Which unfortunately we don't have that either. So, what that tells you is when you're making your decision about whether you want to go into that group setting, you want to expose yourself and your family to more strangers, you need to keep that in mind. And my suggestion would be follow the advice of the people who have trained their adult life to advise us in these moments. And that is CDC, public health authorities like Dr. Phil Wong and his counterpart in Tarrant County, and the heads of infectious disease. That's what this is. It's an infectious disease. And epidemiology, the study of epidemics. Follow their advice. And what they're telling you is stay home as much as possible. Avoid crowds and wear your face covering when you're in the crowds and keep 6-foot distance.
Hey, yesterday, Mayor Johnson said only 1% of the population in Dallas County has been tested for COVID-19. Is that an accurate number? And if it is, what is the goal that will make you guys feel comfortable? How much of the population would have to get tested for you guys to feel comfortable?
As I mentioned, the city has been collecting some of that information, but even that is, it's probably the best information we have, but it's still missing some information. I don't know that, we want to have enough testing. Ultimately, what we've been trying to do initially, we said we were trying to contain it. Then once the spread got too large, we were doing the mitigation and all the orders and the non-pharmaceutical interventions, all these, physical distancing, social distancing. If you get the numbers down, what we want to have is enough testing that we can, identify and pounce on when we start to get clusters of illness, that we have enough testing to be able to be testing the nursing homes, these vulnerable populations, homeless shelters, the jail, other settings, that we're not lacking in those testing. We're still lacking the capacity to really do. We're trying to now work on getting all the nursing homes tested, because we now know there's more asymptomatic person and spread, being able to offer the testing to asymptomatic persons in those nursing homes and all these settings. And that's what we're doing now, but we don't have enough testing to fully do it. So I don't know that there's an exact number, but it's enough so that we can know that we have, we can identify clusters and outbreaks readily, that we also want to have surveillance to have a sense of how prevalent the illness is and infection rate is in our community. We're working with UT Southwestern on some strategies to try to get that. There have been some other communities where you start getting the antibody testing and serologic testing. Once that's better, those tests are better, that we can look at the percentage of people that have been infected and sort of a sample of that to get that. But then if we keep the physical and social distancing going, the numbers, the spread will decrease, so there are fewer infections, and then we want to have enough testing to be able to, and also the contact tracing capability to be able to identify those readily and then snuff those out. So it's not an exact number on that.
Judge, one more question. Some people are wondering if you were one of the first to take action when this whole thing started to shut part of the county down even before the governor did anything. Why, if you could do the same now, or basically not really go against what the governor is saying, but if you feel it's the right thing to do, could you do something similar to what you did when it all started before the state took action? Or you cannot go over the governor's orders?
Oh, I see your question. So the question was, you were one of the first persons to put the Safer at Home in place here in Texas. If you disagree with the governor, can you override that with some other order? The short answer is we're not doing that, okay? The governor has put his order in place, and so where we are is, if the question is, what would I do differently? What I would do is I would listen to the CDC, the public health authorities, the heads of infectious disease and epidemiology, and President Donald Trump on this one, and wait for that 2-week decline. But we are where we are. It does us no good to argue with one another about where we are. And you've got to remember, this virus does not care whether you're a Republican or a Democrat, what your immigration status is, what your ideology is. This is just straight up biology, right? And so what we've got to do now, in the face of a climbing number of deaths and cases, and governor's orders that put more opportunity for us to be around one another and spread infection, it's up to each one of us to make smart choices. As for me and my family, we'll follow the CDC guidelines, which are avoid unnecessary trips. Is it really a good time to go buy a new pair of blue jeans at a store, right? Is now when you really need to go sit in a movie theater. For us, it won't be, because we're going to listen to the CDC. Is it really a good time to go sit in a restaurant as opposed to pick your food up takeout? Well, if you listen to the CDC and the health experts, for that matter, if you listen to Governor Abbott's, he won't tell you that you can't do it, but he says you can go to a restaurant and sit around with your friends, but he advises against it. So, and what he's trying to do, I think, there is he's trying to at least somewhat listen to what the CDC is saying. And so it's up to us now, in the face of what's happening on the ground, what the medical modeling is saying will happen next, and what will happen if we don't continue on the course that we're on and making those good decisions. All the models show a huge escalation, and this thing gets dragged out a lot longer, right? So we've got to make those good decisions. That's our best chance of keeping our family safe and helping get our economy back on track. Thank you very, very much for the time today. Everyone be safe and have a good weekend.
Judge, if you could do Spanish now.